Now, the other statistic that blows a lot of people away is that more people die every year from epilepsy than breast cancer.
Yeah, that's
and
crazy.
then the questions, we've been talking so much about these smaller seizures, if you want to call them that. What would kill someone from epilepsy? And that's when we're talking about a whole body convulsion, fall to the ground. Sometimes people know they're coming, sometimes they don't. And one of the things that I find very upsetting is that it's very common that there's convulsions in people around us, and most people don't know what to do. So I do talks at the schools, and I'll ask kids, I'll say, oh, I'm starting to sweat, and I hurt, and my arm hurts, and they say, oh, you're having a heart attack. I said, what are you going to do? And the kids know. I'm going to call 911, and I'm going to tell you it's okay, and I'm going to think about CPR. I'm like, little kids know this. And then I ask them, okay, what would you do if I do this? And I'll lie down and have a convulsion. I'll show them, and they'll go, I don't know. And the one cool thing about kids is I'll say, well, do you need to put anything in my mouth? And they'll say, well, why? And I'll say, well, your parents, when you go home, they'll say you can swallow your tongue.
That's right.
And the kids go, how would you swallow your tongue? And I'll go, well, you can't. It's attached to your mouth. And I'll make the kids all try and swallow their tongue, and they can't. So that's an awesome thing to know, is that people won't swallow their tongue. And if someone is having a convulsion, you want to be able to approach that person and know they're not crazy, they didn't bring this on, it's not because they've been drinking too much, they're likely not faking it in any way, they're not going to hurt anyone who's a bystander, and you don't need to put anything in your mouth.
Really?
And the tongue is going to stay there, the teeth are often clenched. If you get someone at the onset of a seizure and you could put something in their mouth, like let's say a pencil, now they can get splinters in their tongue.
Wow.
Or something harder, now they can get broken teeth. So we can't prevent the jaw from clamping down. So we're going to leave the mouth alone, even if we think there's food in it. We're going to roll them on their side if we can, so that if they vomit, it'll go out and not in. But if you can't, you put something soft under their head if there's something around, and you wait till it's over and you look for identification. Most people wear the bracelets, some people wear a necklace. Some of the patients I take care of won't tolerate the sensation of a bracelet or a necklace, and I tell them to get a shoe identification. But if you see that they're known to have epilepsy and it stops within 3, 4, 5 minutes, you can just, when it's over, say, are you okay? Are you okay? You just had a seizure. And if it doesn't stop or you don't see identification, you call 911, just like you would if someone looked like they were having a heart attack.
Yeah.